Member for Caroni East.
Thank you, Madam Speaker, for allowing me to join the debate into the 2024 budget. I would first like to begin by commending my political leader on a majestic and commanding reply to the most uninspiring budget laid by this PNM government since they have taken office in 2015. I would like to concur with her that there can be no prosperity without safety and security in Trinidad and Tobago. Madam Speaker, every single ministry is failing, and the people of Trinidad and Tobago are the ones that are suffering. My colleagues have dealt with many of the faults of this budget, and I also congratulate all of them on their contributions. On this side of the House, we will continue to fight for equality and a better standard of living for all citizens. It is a patriotic duty that we take most seriously. We will never be deterred by the naysayers on the other side. It is our duty to protect our family and our loved ones from the continued mismanagement of our nation's resources under this PNM government, and to return Kamla Persad-Bissessar to the Prime Minister of Trinidad and Tobago. Madam Speaker, the Minister of Health gave his contribution a little while ago, and it was a rambling contribution. It was almost as if he was giving doctors a continuing education lecture rather than a strategic direction of the Ministry of Health going into 2024. Madam Speaker, according to PricewaterhouseCoopers, the national diversification strategy has not been successful to the levels required despite decades of discussions. Access to foreign exchange remains a persistent challenge for those that have small and medium businesses. Key contributors to earning foreign exchange, namely the petrochemical plants as well as the LNG facilities, continue to face gas shortages. We need roughly 4.2 billion cubic feet per day, while current production is around 2.6 to 2.7 billion cubic feet per day, and will be so until at least 2025. Crime and criminality remain a scourge of our society, causing a brain drain and impacting diversification. There is reduced business activity due to the lack of foreign direct investment, as well as the difficulty in ease of doing business. The Heritage and Stabilization Fund has not grown in the last 7 years. Government debt to gross domestic product is at 71%, while the target is 75%. And yes, we have another deficit budget at $5.2 billion, or 2.7% of GDP. So, Madam Speaker, the question remains, how does the government intend to treat with these issues? After all, it is not a UNC government assessing the socio-economic performance of the government, but PricewaterhouseCoopers. And how does this budget build capacity for diversification and growth? We are running a fiscal deficit of $5.1 billion, and I can recall a few budgets ago, while the Minister of Finance having accused the partnership government of heating up the economy with a massive budget. Madam Speaker, this budget of $59 billion is on par with any budget the partnership government did at our time. The health sector is getting $7.4 billion, the second largest allocation in the budget. And will citizens of this country see a shorter wait time for beds? Will young unemployed doctors get jobs? Will patients get drugs that they need? Or will doctors have the basic diagnostic equipment available to them? As we have seen for the last 8 years, Madam Speaker, most likely not. The member for Faizabad did a fantastic rebuttal to the Minister of Health, and I commend him for his contribution, as well as the member for Kumoto Manzanilla. Madam Speaker, I will try my best not to tread on the areas that they have explored thus far. I will start off with the infrastructure of medical institutions as highlighted by the Minister of Finance. The Minister of Finance has said that the government has spent or is spending billions of dollars to build out the country's health infrastructure and will address non-communicable diseases next. The Arima Hospital has a cost of $1.6 billion. The Point Fortin Hospital has a cost of $1.3 billion. The Sandy Grande Hospital is at a cost of $1.1 billion. And the central block of the Port of Spain General Hospital is at a cost that is yet to be determined. It has been allocated to be a premier teaching hospital, as stated by the Minister of Health. But the same was said for the Cuba Hospital not more than a few years ago, Madam Speaker. And apparently, the Minister has forgot to thank my political leader for the vision and the plan to design and build the Cuba Hospital. An institution, Madam Speaker, that was integral to saving thousands of lives of citizens from COVID-19. It was our country's Noah Ark during the storm of COVID-19. I was expecting the minister to also thank my political leader for the San Fernando Teaching Hospital, as well as her vision for starting the Arima and the Point Fortin hospitals. Madam Speaker, had my leader not started the Arima and the Point Fortin hospitals, would this PNM administration even have built them? We will never know. Madam Speaker, starting with the Arima Hospital, this PNM government continues to shamelessly take credit for the Arima Hospital, which was commissioned by the People's Partnership Government. Construction of the Arima Hospital was formally approved by the UNC People's Partnership Government on the 3rd of October of 2013. Then Arima MP Roger Samuel announced at a post-cabinet press briefing that China Railway Limited was the constructor in a government-to-government agreement with China at an estimated cost of $1.6 billion. That was after Prime Minister Kamla Persad-Bissessar held bilateral talks with the Chinese President Xi Jinping during his 2013 state visit to Trinidad and Tobago. The Point Fortin Hospital, Madam Speaker, the UNC People's Partnership Government also turned the sod to begin construction of the $1.2 billion Point Fortin Hospital in May of 2015. The project was executed under a government-to-government arrangement between Trinidad and Tobago and Austria, who was also the country that was also involved in the construction of the San Fernando Teaching Hospital. The Minister of Health at the time, Fuad Khan, said that he met no plans in place to build a new hospital in Point Fortin when he entered office in 2011. And he went on to say, when I came here in 2011, I saw the old Point Fortin Hospital in a total state of disrepair, and I could not believe that the people of Point Fortin were putting up with this type of hospital for such a long time. It was never the intention of the PNM to build the Point Fortin Hospital. Madam Speaker, the Point Fortin Hospital was initially budgeted for $1.2 billion. Its final cost is now $1.3 billion. The minister has a duty to the people of this country to account for the extra $100 million. Where has the money gone, Minister? And only PNM can do that. Madam Speaker, moving on to the Sandy Grande Hospital. In 2019, Minister of Finance Colum Imbert stated that the Sandy Grande Hospital would be constructed using the design for the Point Fortin Hospital, with financing as well from the government of Austria, and it was estimated to cost $850 million. Minister of Health, Terence Dialsing, added that the reason it was cheaper was because the UDICOT fees were reduced, as it was the same design as the Sandy Grande Hospital. Madam Speaker, today the Minister of Finance is telling us that the Sandy Grande Hospital is costing taxpayers of this country $1.1 billion, $250 million more expensive than the 2019 budgeted figure. So the minister must account to the citizens of Trinidad and Tobago for the extra $250 million. COVID-19 cannot be a blank check for mismanagement. Too many excuses while many in our country suffer. So, Madam Speaker, between the Point 14 and the Sandy Granny hospitals, we have so far $350 million in cost overruns. Moving on to the Port of Spain General Hospital Central Block. We have the new Central Block, which was announced on the 13th of May 2019. And the main contractor at the time, Shanghai Construction Group, pulled out of this arrangement. And as a result, UDCOT had to hire local contractors to complete the work. CEO Noel Garcia said at the time, the project had an initial budget of $1.1 billion. Madam Speaker, in the 2022 budget debate, Minister Dialsing revealed that the Port of Spain General Hospital Central Block was now going to cost taxpayers at least $110 million more and take an additional 2 years. I am sure that sum is considerably more now, but I'm going to use the old figure from 2022 of $110 million more. So we still do not know the final cost of the Port of Spain Central Block. So between the Point 14, the Sandy Granny Hospital, and the Port of Spain General Hospital Central Block, we have at least $460 million in lost value to the citizens of Trinidad and Tobago. And that is what the minister should have spoken about. And then we have the San Fernando General Hospital addition. It doesn't end there, Madam Speaker. The minister's finance boasted of a 9-story parkade at the San Fernando General Hospital. The estimated cost of this so it started as an 8-story car park, costing $118 million, and was scheduled for completion on April 2022. Madam Speaker, the San Fernando Parkade was eventually built with 9 stories, an extra story, and for the last quoted price was $132 million and opened in August 2023. Minister Dialsing speaking at the official opening ceremony.
Member, just remember, I know it's a little difficult. So, Minister of Health or the member for St. Joseph, just now you did it with Diego Martin, the member for Diego Martin Central, Diego Martin Northeast, the Minister of Finance.
My apologies. Minister of Health, speaking at the official opening ceremony, said that the previously free car park to the back of the hospital was no longer available to the public, and instead patients would be directed to the parkade, which would carry a cost of $8 an hour or $60 hourly rate. So, Madam Speaker, patients at the San Fernando General Hospital now have the pleasure of paying to park at the parkade to access health care at the hospital. And I would like to ask the Minister of Health which other health facility we have in Trinidad and Tobago where patients have to pay to attend the health facility. So this initial car park initially cost $118 million, Madam Speaker, but was eventually built for $133 million, with the specs being changed from 8 stories to 9 stories. Right? That's a whole other issue by itself. Why the sudden urge or the need to change from 8 stories to 9 stories to park more cars? Minister, at some point, would you please account to the citizens of Trinidad and Tobago at least $15 million over budget? So currently, we have the Point 14 Hospital, we have the Sandy Granny Hospital, we have the Port of Spain Central Block, and now we have the San Fernando Parkade, with at least $475 million in lost revenue and lost monies to the citizens of Trinidad and Tobago under the Ministry of Health. And that is what the minister should have spoken about. But that is not all, Madam Speaker. We also have the Ministry of Health Administrative Building, which is obliquely opposite Memorial Park in Port of Spain. And this was constructed through a public-private partnership, utilizing a build-own-lease transfer arrangement. And the initial cost of the administrative building was $280 million, Madam Speaker. And this was started in the 1st of December 2020. At the time, our country, our Ministry of Health, was paying roughly $10 million in rent per year for the ministry. Under this arrangement, the government of Trinidad and Tobago will pay $30 million a year for 15 years in lease payments to NH International at an estimated cost of $450 million, Madam Speaker. So the headquarters will be leased by the Ministry of Health for 15 years and then transferred to the government of Trinidad and Tobago after the conclusion of this agreement. So, but quite surprisingly, Madam Speaker, with this project that started in 2020, it was finished for the exact same price when it was completed, $280 million. So there were no cost overruns in the Ministry of Health administrative building. And you know why that was, Madam Speaker? Because it would have eaten into the profits of the private contractor. The private contractor was the one that took out financing to build this facility. So construction took place during COVID-19, but somehow with the other Ministry of Health projects, there were massive overruns and overdue times, Madam Speaker. So this is the only Ministry of Health project to come on budget. But you must also remember, Madam Speaker, it was built for $280 million, but at the end of it, the people of Trinidad and Tobago are going to pay $450 million. $170 million more than the cost of the contractor's cost for building the Ministry of Health administrative building, excluding interest fees for financing. So, Madam Speaker, between the Point Fortin Hospital, the Sandy Grande Hospital, the Ministry of Health administrative building, the San Fernando Parkade, we have $645 million in lost value for the citizens of Trinidad and Tobago. And this does not take into account the feeding frenzy that occurred during the pandemic under the Minister of Health's tenure. And this must be his legacy, Madam Speaker. This must be his legacy. Billions of dollars spent and unaccounted for. Many questions are left unanswered. But under Kamla Prasad Bisesa government, we will get the answers for the people of Trinidad and Tobago. Madam Speaker, the Minister of Health in the budget report stated that the Minister of Finance in the budget report stated that ever since the assumption of the first PNM administration in 1956, that there has been expanding of our public health system to provide free access to a range of health solutions and services for our citizens at levels unavailable in many advanced and emerging and developing countries. The impact on our nation's health has been significant. And Madam Speaker, Dr. Bodo, the member of Parliament for Faisalberg, spoke briefly about this, but I will go into more detail. While the Minister of Finance is boasting of building this nation's health infrastructure, a report conducted in conjunction with this government and the World Health Organization has stated in clear terms that our health sector is under-resourced. The World Health Organization, in its observations on health systems and policies, stated in very, very plain terms, countries are prioritizing building up a physical infrastructure and procuring equipment and supplies, but increasing the number of hospital beds or ventilators is futile if there are not enough hospital staff to operate them. And I'll repeat that. It is futile if there are not enough hospital staff to operate them. And this is my firm contention that this is what happens here in Trinidad and Tobago. On numerous occasions, Madam Speaker, I would have spoken to you before about the Seamongal report, but today I will discuss an Auditor General's special report that we now have access to. And the Minister of Health made no mention of this in his contribution. On the 5th of June, 2023, a special report of the Auditor General of the Republic of Trinidad and Tobago was laid right here in the House of Representatives. It is named Contributing Towards a Strong and Resilient National Public Health System between the years of 2016 and 2021, PNM years, Madam Speaker, and it's based on our country's ability to detect, reduce the risk of, and to manage a global health risk. And this is under United Nations Sustainable Development Goal, Target 3D. And the Auditor General's special report was done under the authority of the World Health Organization, along with the Ministry of Planning and Development, as well as the Ministry of Health. And it utilized contributions from the PS of the Ministry of Health, the Chief Medical Officer, staff of the Regional Health Authorities, the ODPM, Airports Authority, as well as the Trinidad and Tobago Registered Nursing Association, and the PAHO representative in Trinidad and Tobago. And it makes for quite interesting reading, to put it mildly. The report has concluded that a more resilient healthcare going forward would only be achieved when Trinidad and Tobago new and existing health facilities are adequately staffed and equipped for future health shocks. Madam Speaker, first on the agenda, inadequate human capital. And the member for Faisabad spoke about this briefly. The Auditor General's special report stated that we currently have a ratio of 1 doctor, nurse, and midwife per 1,000 persons in Trinidad and Tobago, whereas the World Health Organization's recommendation is 4.5 doctors, nurses, and midwives per 1,000 persons. According to the World Health Organization, Madam Speaker, we are significantly undermanned in our nation's hospitals and health centers, and thus we are unable to provide a high level of patient care compared to other countries around the world. Madam Speaker, as you would remember, as I have said before in this chamber, according to COVID-19 data, we are number 172 out of 175 countries in our performance in COVID-19. The special report went on to say that out of approximately 17,682 healthcare positions in Trinidad and Tobago, 37.6% of them were vacant, or 6,647 positions at the end of 2021. And not much has changed since then, because we have the yellow books for 2022 and 2023. So that's almost 40% of positions that are vacant. And the highest number of vacancies, Madam Speaker, were across the regional health authorities, was in the profession of nursing, building new hospitals, spending billions upon billions with new hospitals, but no jobs for unemployed young doctors and nurses. Shameless. Madam Speaker, the report also went on to say there was a lack of medical equipment at our health institutions, and that doctors are concerned about their ability to diagnose patients. A survey was done, that is in the report, Madam Speaker, of 319 healthcare workers, and it revealed that 65% of doctors stated that there was inadequate access to medical equipment to diagnose and treat patients at our public institutions. In fact, representatives from health associations and private health institutions expressed concerns over this fact. And as you know, doctors are bound by their non-disclosure agreements. So this is the closest that we have gotten to confirmation of negligence by the regional health authorities and by extension the Ministry of Health by not providing the adequate equipment to these health professionals. So from the years 2016 to 2021, $25.5 billion was budgeted by the Ministry of Health. But where has the money gone? Where has the money gone? They are building hospitals, Madam Speaker, lacking equipment and lacking staff. But it goes even further, Madam Speaker. The report spoke about the fact that there's no integration of our IT systems, our information technology systems, and there's no interface with the systems from the Ministry of Health IT systems. There are information technology systems in place, but they are not connected. So there's no integration across the IT systems in the regional health authorities to facilitate the ease of data sharing for decision making, nor interface of these systems with the Ministry of Health systems. So You can't go from hospital to hospital and expect your information or your radiographs to be transferred very easily. It just cannot happen. The full functionality of many of the systems used, including SELMA IT system at the Southwest Regional Health Authority, was not being utilized. Madam Speaker, the report also went on to say that there was gross disrespect meted out to the Trinidad and Tobago Registered Nursing Association. According to the report, the TTRNA was not included in any decisions concerning COVID-19, and the Minister of Finance in his budget speech was speaking about our advanced healthcare. And this is contrary to many other countries around the world, where the import of nurses was used to optimize equipment and resources at the height of the pandemic. These nurses have endured so much under this long-standing Minister of Health. Also mentioned was the fact that the TTRNA was refused health insurance and hazard allowances during the pandemic, which is the norm in most World Health Organization countries. In the report, on a side note, Tobago is the only regional health authority that has met its staff figures, but that is because it falls under the authority of the Tobago House of Assembly. And this was most apparent during the pandemic when nurses had to do the job of 2 and 3 nurses. Our nation's shortcomings, Madam Speaker, have been highlighted in the 2020 State of the World Nursing Report, which analyzes data from 191 countries, including Trinidad and Tobago. And for countries such as TNT that are unable to retain their best nurses, the report has advised that we should consider improving the salaries and working conditions, creating professional development opportunities, and allowing nurses to work to the full scope of their training, something that the Minister of Health has ignored, consistently ignored. President of the Trinidad and Tobago Registered Nurses Association, Edie Stewart, is on record of saying that nurses are currently working on 2013 salaries, and many have no choice but to seek employment abroad. Madam Speaker, currently nurses' salaries are among the lowest in the public service, and the disrespect continues, as the Member of Parliament for Faizabad said. Nurses are only given short-term contracts, and because of this, they are unable to access loans and acquire a house and other assets. These short-term contracts create great uncertainty and depress the morale of those who are exposing themselves to the most risk. And there are over 3,400 nurses that are working under these conditions. The Auditor General's report, which was obviously had input from the Ministry of Health, indicated that our doctors and nurses were burnt out as they were forced to work extra hours, giving up their vacation leave. The Minister of Health spoke before about mental health, but what about mental health of our health professionals, Minister? Mentioned was the fact that there was unpaid overtime, job insecurity, poor meals, lack of transportation, no childcare support, and very poor working conditions. $25.6 billion to the Ministry of Health during this period under assessment. And perhaps this was the most interesting part for me, Madam Speaker. The report said of long wait times and the postponement of surgeries. The Auditor General's special report said that 64% of patients had longer wait times than normal during the pandemic. A survey of 1,049 persons found that 63% said that there were frequent postponement of elective surgeries and medical appointments during the pandemic, and 64% of respondents indicated that they had longer waiting times than normal at health facilities during the pandemic. And Madam Speaker, this finally puts to rest that there was a parallel healthcare system. There was no parallel healthcare system. Doctors were simply transferred to a COVID-19 facility to the detriment of the hospital or the health facility where they came from. And that is the reality. Parallel healthcare was another P&M gimmick, Madam Speaker. Madam Speaker, moving on to the NCDs, and the Minister of Health spent a considerable amount of his contribution with regards to NCDs, but I would like to tell the Minister that he's placing too much emphasis on...
Remember you're addressing your contribution to the chair. So remember, this is the budget. This is not a motion against the minister. So try to depersonalize it a bit. Okay, please.
I understand, Madam Speaker. So, Madam Speaker, there's too much emphasis with regards to policy on individual responsibility for health, and not enough is being done with regards to policy that is required from the Ministry of Health, Madam Speaker. So the Ministry of Health has received roughly $500 million more than last year's allocation. And President of the Diabetes Association, Andrew Danu, is hoping to see some of this extra funds used towards diabetes and NCDs prevention programs. And he's hoping that money would be allocated towards hiring diabetic nurse educators in every health institution in Trinidad and Tobago. And what he is saying is that citizens need to be educated on managing their blood sugar levels with nutrition and exercise, as well as with medication. And this is something that we are hoping that the Minister of Health will do in this fiscal year. The International Diabetes Federation estimates that there are roughly 150,000 adults living with diabetes in Trinidad and Tobago. And the Minister of Health talks the talk, but he must also walk the walk, respectfully, Madam Speaker. And more must be done to combat NCDs. Madam Speaker, another issue we have with regards to NCDs is that currently, and the Minister of Health did not say this in his contribution, CARICOM countries are preparing to vote on whether to approve front-of-package warning labeling on all food items. And if approved, these octagonal warning label system will be added to food packaging containing high levels of sugars, sodium, and fat. And this follows the PAHO nutrient profile model. Madam Speaker, on the 14th of October 2023, that is the deadline that has been given to all CARICOM countries to turn in their vote to either accept or to reject this regional standard. And Madam Speaker, in 2021, the standard was approved by Antigua and Barbuda, Barbados, Dominica, St. Lucia, the Bahamas, and Suriname. But you know who didn't vote for it, Madam Speaker? Trinidad and Tobago. Trinidad and Tobago did not vote for this very important mechanism that could help in the fight against NCDs. And because, Madam Speaker, a consensus was not reached in 2018, the process had to start over again. So we actually contributed to holding back that process. And this system, Madam Speaker, would empower citizens to make an informed decision when purchasing food items and being able to identify foods that are high in sugar, sodium, and fats easily. The minister was telling us about plantain bhaji or something, I can't remember. But this is more important, Madam Speaker. We need to know which foods, we need to identify which foods are high in fats and high in sugars. The rates of childhood obesity are linked to ultra-processed foods. I'm calling on the Minister of Health, through you, Madam Speaker, for the reasons why Trinidad and Tobago abstained in the vote to approve front warning label foods. And I would like him to state our country's position going into the October vote, Madam Speaker, because he is such a fighter for NCDs. Madam Speaker, some countries have gone even further. In the UK, a levy was imposed 7 years ago on sugary drinks, which has motivated companies to change their products. So we are not doing all that we can do. That is my point. Companies in the UK pay more taxes for beverages with a high sugar content and less tax for drinks with a lower sugar content. Companies such as Lucozade Ribena, the makers of Lucozade Energy, took the decision in 2016 to lower the sugar content in its drinks by 50%. So the Minister of Health is putting too much responsibilities for healthy living on individuals, and this should be done via policy-driven directives implemented by the government after extensive public consultations. Madam Speaker, what is being done to educate the public and to limit the importation of foods containing industrially produced trans fats? What is being done to educate the public about the front of package warning labels? Right, that was a big secret. Nobody knew about that, right? What is being done to implement the WHO recommendation to make every school a health promoting school? And what is being done to implement the indicators in the Healthy Caribbean Coalition's Childhood Obesity Prevention Scorecard, Madam Speaker? So, Madam Speaker, that was my little contribution on NCDs and the Minister's failure, continued failure in fighting NCDs. I would like to now move to address the external patient program, specifically the renal dialysis program. Madam Speaker, in 2016, $15 million was paid for dialysis services through the renal dialysis program. In 2022, that amount has ballooned to $90 million for outstanding payment for an estimated 1,115 patients. And in this budget, they're asking for even more money, Madam Speaker. And in the past, private health institutions have threatened to withdraw their services if payments were not made in full. So, Madam Speaker, my question through you is, why does it take years for a health provider to be paid? These institutions are being asked to provide life-saving procedures to assist in the government's backlog. And Madam Speaker, what I would also like to ask the Minister of Health through you is, are our dialysis treatment facilities in our public healthcare institutions at 100% capacity? The Minister is saying, on record of saying, patients may not necessarily have to attend private facilities to be dialyzed. In 2018, dialysis equipment was purchased for the Eric Williams Medical Sciences Complex. In 2019, Point Fortin Hospital was moved to a 24-hour rotation so more patients could receive this treatment in the public sector. In 2020, 30 stations were procured for the Couva Hospital, which has a very, very low operating budget this fiscal year. And in 2022, 6 dialysis stations were procured for the Port of Spain General Hospital. So the ministry is asking for more funds this year for dialysis machinery. And my question through you to the minister is, are we going to return to some level of normalcy post-COVID-19, or are we still going to see these very high exorbitant bills from these private healthcare institutions? Madam Speaker, moving on quickly to CDAP. CDAP was introduced in 2003, Madam Speaker, and it is to assist patients that may have a range of chronic diseases to access costly prescription drugs. And its mandate was to reduce the burden on dispensaries, to minimize patient waiting time, as well as to provide social support to citizens in need. But Madam Speaker, in June of 2018, a decision by Cabinet made modifications to CDAP, and there have been considerable issues since then. Of concern, Madam Speaker, is the issue of the Ministry of Health buying or procuring the cheapest medication available for CDAP. All medication, I'm asking the Minister that all medication, including CDAP drugs, to be tested for its efficacy. Trinidad has no facilities or limited facilities to test these medications, Madam Speaker. And pharmacies are also having the issue of having a reliable supply of pharmaceuticals due to non-payment by the Ministry of Health. So I'm calling on the Minister to introduce incentives for rural pharmacies to join the CDAP program, as well as a drug certification panel that would have oversight to test the efficacy and safety of drugs, and thus reduce the number of counterfeit drugs entering our borders. The government, Madam Speaker, must also be more consistent with their payments to these pharmacies. Madam Speaker, moving on to the Children's Life Fund. The Children's Life Fund was a creation of my political leader, Kamla Prasad Bisesa, and its mandate was to provide funding and critical support specifically for children needing life-saving tertiary level health care not available in Trinidad and Tobago. And there are lingering concerns, Madam Speaker, that the fund is not accessible to some seriously ill children. Some have advocated for the fund to cover patients with beta thalassemia major, a major blood disorder that reduces hemoglobin. And the cure, Madam Speaker, is a bone marrow transplant. And certain children have been denied access to the Children's Life Fund as they were told that they could not qualify because the fund is not the condition isn't life-threatening. So these parents have had to go the route of raising funds through barbecues and GoFundMe campaigns. Exactly the situation that the Children's Life Fund was created to address. So my point here, Madam Speaker, is the threshold is set a bit too high to access the Children's Life Fund. And we must amend the legislation for a medical team to give oversight and approval to applicants seeking treatment under this fund. Compromise of qualified clinicians both in the public and private healthcare sector. Madam Speaker, the Minister spoke about AIDS and our goals with regards to AIDS. There's a paltry allocation, Madam Speaker, of $100,000 in this year's budget, as there was last year, towards the engagement of a consultant to conduct public consultations to publish the final policy and to launch media activities with regards to the AIDS policy. And Madam Speaker, HIV or AIDS is one of the top 10 leading causes of death in Trinidad and Tobago, with the largest increase in newly reported HIV cases occurring between the 20 and 49-year-old age group. We have failed in our objective to realizing the goal of getting to zero new infections, zero AIDS-related deaths, zero stigma, and zero discrimination. The Minister hasn't spoken about this at all. There continues to be significant issues with early sexual initiation, individuals having unprotected sex, using inconsistent protection, multiple partners, and so on. So there's great need, Madam Speaker, for information dissemination and education. And in my view, $100,000 is not sufficient to address these targets. Madam Speaker, while the Minister of Finance boasts of achieving, as well as the Minister of Health, boasts of achieving 2030 targets, I would like to remind him that in 2015, the newly elected Rowley government indicated its commitment to making universal health insurance a reality. And the Minister of Finance at the time said in 2015, the universal health insurance program has been an elusive goal, and we will place universal health insurance high on our agenda and ensure by December 31st, 2018, a national health insurance system will be in place and operationalized, thus bringing much relief to all citizens. Madam Speaker, we are perhaps further from this than ever before. So I'm calling on the government, and specifically the Minister of Health, to immediately implement a national health card, which was a UNC People's Partnership initiative to allow patients to access health services and medications throughout the public sector, Madam Speaker. Madam Speaker, with the little time that I have left, I would just like to quickly jump to the Ministry of Planning and Sustainable Development, and I'm hoping that the Minister would be able to respond to some of these issues as I shadow sustainable development as well. So, Madam Speaker, turning to the issue of sustainability, sustainable development, and climate action. Climate change has been a widespread impact in all areas of the world, affecting the lives of billions of persons, causing acute food insecurity, as well as the reduced access to safe water. And according to the 6th assessment report of the Intergovernmental Panel on Climate Change, the Caribbean is highly exposed, vulnerable, and strongly impacted by climate change. Madam Speaker, this situation is made worse by factors such as poverty, high population density, deforestation, soil degradation, and a high dependence on natural resources. And the report goes on to say that the conditions of vulnerability are projected to worsen as the average global temperature continues to rise. And to address these challenges, there must be urgent and assertive
Honourable Member for
action.
Caroni, your original speaking time is now spent. You're entitled to 10 more minutes to wind up your presentation if you wish.
Thank you. I will. Thank you. So, Madam Speaker, as a small island state heavily impacted by soaring temperatures, rising waters, and coastal erosion, this government remains tardy with respect to its outlined goals. The government has not reported to the nation on any of the targets indicated in the National Climate Change Policy, and it's fair to say that there are no measurable achievements. There are no indications that the objective of a 30% reduction in greenhouse gases by 2030 is being met. This is unacceptable, especially since Trinidad and Tobago has a high carbon dioxide emission rate per capita. The government has also not updated citizens on the cutback of carbon emissions, the reduction of plastic and other pollutants, and the replanting exercises to fight the impact of climate change. The country should be properly informed of the status of all climate change mitigation measures, including the introduction of sources of new renewable energy. I would like to take this opportunity to tell the nation that an environmental program has been launched by the Caroni East Constituency Office, in which my staff and myself have provided nursery plants to all post-secondary students, post-SEA students in Caroni East. Aptly named Let's Grow Together, we have delivered plants to each post-SEA student in Caroni East. So the students were asked to grow the plants, and we returned 1 month after to see the state of these plants. The eventual winner, and we judged them by school, was Warrenville TIA School, but their students, in conjunction with their dedicated principal, were able to have their plants thrive and prosper. Madam Speaker, in addition to giving the students the plants, we also gave them lectures on sustainability and the SDGs and all the world, the UN protocols on the vital importance of growing and protecting plants and generally upholding our environment and shielding it from further degradation. I urge the government to examine this program with a view to adopting it as an official exercise to be emulated throughout Trinidad and Tobago. Madam Speaker, in the coming years, we should also work towards accomplishing even loftier objectives and to meet the requirements of the Paris Agreement and the 2030 Agenda for Sustainable Developmental Goals. And Madam Speaker, as we speak now, climate crisis is real. It's unprecedented, urgent, and it's happening right now. And this requires Trinidad and Tobago to make strong policy, economic, social, and financial decisions. And not to, we have to do our part in the mitigation and adaptation to this new reality to save our islands as well as to save our livelihoods. The Minister of Finance has said nothing on sustainable development goals, nor any policy changes for climate change, mitigation, climate change abatement, and nothing on disaster reduction management. The minister is coming now with the solar park from BP Light Source, coming soon, 8 years now, that would herald a new green hydrogen economy. But what the minister did not say is that there has been no progress for years with apparent controversy of high tariff prices, land acquisition issues, as well as the possible withdrawal of TNTech. And quite interestingly, at an international level, Madam Speaker, that may have repercussions here in Trinidad and Tobago, Shell has announced that it would be refocusing on its core oil and gas operations under new CEO, Wael Sawan, who has said that its upstream hydrocarbons business is now center stage. So the oil giant Shell is looking to sell options for its renewable power business and considering a possible part sale of its green power operations to an external investor. Shell has in recent months exited offshore wind projects in Ireland and France, and it has sold its UK power retail business and said that it was seeking to sell stakes in renewable projects in India. It's also weighing selling all or part of its sun and battery storage company acquired in 2019. And several senior Shell executives have left the low carbon and renewables division since the strategy change happened a couple months ago, Madam Speaker. So, Madam Speaker, the 112 megawatt solar project is slated to be built by a consortium comprising BPTT, Shell, and Lighthouse. So I would like to ask the Minister, possibly the Minister of Planning and Development, to assure or to reassure the public that Shell will continue to be part of the solar park. Madam Speaker, with regards to the Ministry of National Security, the Minister of National Security went on about crime as a public health issue. And Madam Speaker, I would just like to touch on that very quickly. Basically, there are 4 key steps in designing a public health response to any threat of well-being. And these are identifying and monitoring the extent of the problem, identifying the cause of the problem, formulating and testing ways of dealing with the problem, as well as applying widely the measures that are to be found. And these measures can be primary, secondary, or tertiary, and can take the following forms, and I'm trying to advise the Minister here. Universal interventions. These are approaches aimed at large groups of people, usually the general population, without regard to individual risk. And examples would include violence prevention curriculum delivered to all pupils at the secondary school level, or a community-wide media campaign. Selective interventions, and these are approaches aimed at those considered to be at heightened risk of perpetrating violence. An example would be giving parenting skills to parents of low-income families, right? And then there are indicated interventions, and these are approaches aimed at those who have already demonstrated violent tendencies or behaviors, such as persons that have done domestic violence. So, Madam Speaker, instead of 1,000 more police officers, what we really needed was 1,000 more social workers and student counselors in our schools to identify antisocial behavior and to treat with it according to the guidelines of their profession. And this was done during the partnership government under Kamla Prasad-Bissessar, Madam Speaker, and it will be returned under her tenure as Prime Minister in 2025. Madam Speaker, what is needed is prevention rather than cure. In some jurisdictions, when the number of officers were greatly expanded, many who entered the police force were not ideally suited for the job. And we must be ever so vigilant of those who we bestow the powers of law enforcement. And Madam Speaker, in the very little time that I have left, as I usually do, I am asking the Minister of Health to look into amending the Dental Act and allowing the prosecution of non-registered persons performing dentistry. As it stands, there's nothing in law preventing a person who is not duly registered or enrolled to practice dentistry from importing, gaining access, or being in possession of drugs, dental equipment, and paraphernalia pertaining to dentistry. And the Dental Council of Trinidad and Tobago is asking for this, and they have been asking for this for many, many years, Madam Speaker. It is in the public interest to restrict importation, access, and possession of dental drugs, equipment, and other associated items to only dental professionals, dental schools, registered suppliers, hospital, health clinics, and the appropriate arms of the government. So, Madam Speaker, with those few words, I thank you for your indulgence, and I thank you for allowing me to contribute in this year's debate. Thank you very much.